My name is Katie Aliberti, and I am the social worker here at the Hallquest Memorial Inpatient Center. I've been in this position for about 6 months. Prior to that, I was working in home care for Capital Caring in the Arlington region, and I worked in that capacity for about a year and a half. I've been a social worker about 3.5 years. This was a second career. I trained to work in hospice and palliative care at Brigham and Women's Hospital in Boston, where I worked in their palliative care program. My work at Brigham and Women's was focused on inpatient care, so we served patients who were part of the oncology program at Brigham and Women's in Dana-Farber, and we worked with them while they were inpatient and didn't have a chance to follow them once they went home. Currently, I work with patients at Capital Caring who are in our Hallquest Memorial Inpatient Center exclusively. So I don't work with patients once they go home. Our home care teams do that, and the same when they go to nursing homes. So once a patient is admitted to our inpatient center, I make contact fairly quickly. If they come during business hours, I make contact within an hour or two, and then I follow up continuously on a daily basis, both with the patient and family and also with our interdisciplinary team. I get asked what I have to offer patients and families quite a bit. So I think that my role is really varied, and that's part of what I like about my role as a social worker. But for families and patients at our inpatient center, I offer them definitely support and adjustment to disease progression. I also offer help with community resources. This is particularly important if they're going home. I assist with discharge planning, and I also am kind of the voice of psychosocial needs for the interdisciplinary team. So when we round, I can talk about adjustment issues that patient and family are having. I get a lot of different requests from patient and families, and sometimes it's kind of hard to fulfill those requests. They're a little bit outside of not just the scope of what I do, but the scope of what's normally expected. But we have had wedding ceremonies here, we've had birthday celebrations. We try to accommodate patients and families so that the time that they spend here is memorable, in a sense that it was comforting. So sometimes those are the types of things that we're able to offer, and those are the most meaningful. So the interdisciplinary team is important to hospice, and it's part of what makes us unique. So the team includes a physician, nurses, CNAs, myself as a social worker, chaplaincy, and also the patient and family. So that is the whole team. So daily, we're talking about patients and families' needs, and sometimes those needs can change really quickly. So I think that communication is a huge part of what we do. And so I'm always in the doctor's office, I'm always with the nurses, and I think that that collaboration is what makes hospice care really unique. We take patient confidentiality and HIPAA laws very seriously. In my conversations with patients, I keep everything that they tell me confidential unless they let me know that they'd like me to talk to somebody about that, or if a patient presents a danger to themselves or to others, in which case I would need to tell somebody to protect the patient's safety. But short of that, I try to keep my conversations confidential unless there's something that's really important for the rest of the IDT to know. So When patients leave the inpatient facility, they're often going home. And when they are able to go home, I alert the home care team, and they're the ones who follow up. I don't have enough time to be able to go and visit patients who I see here in their homes, so the home care teams take care of that. If a patient passes away at the inpatient center, I follow up with their friends and family for bereavement support. So I think that an ideal interaction with a patient or with a family member here at the inpatient center involves that family member or patient feeling more comfortable with the fact that they're here. Sometimes they're more comfortable because they're not in pain. Sometimes it's that they give me a hug because there's something that I said that was able to be comforting to them. And that's what's fulfilling about my work, and that is what keeps me coming back every day. I think that one of the difficult things about social work in general, and then working in hospice, is that we are constantly asked to do different things every day. So every day is different, every patient's different, every family member is different. And I think that one of the challenges is just figuring out how to meet people where they are and not make assumptions about what they need or the choices that they've made. So I think that that's just kind of a constant struggle for people in the helping profession, and then certainly I struggle with that too. So having worked in both home care and here at the inpatient center, there are definitely differences in my role here than the home care social worker role. The home care social workers first log a lot of hours on the road, and they're traveling from patient to patient. The benefit for me being here is that patients and families really come to me, and so I don't travel as much anymore. I also have the ability to often interact with a lot more family members, because when folks come here, they're often acutely in need of support, and family members are also looking for that support too. So I think that in that way it's a bit different here. Volunteers are really an important part of the interdisciplinary team. They are on the floor here at the inpatient center. They are often providing patient care. They are feeding patients. They're providing some of that comfort that for just one of me or a couple of the nurses, it's really hard to provide ongoing throughout the day. So volunteers really bridge that gap. And they're also able to tell us if a patient is in pain, if they're having trouble swallowing. And often we use that information that volunteers give us to make decisions about patient care. One of the ongoing conversations that I have with families is them saying, how can you do this work? How can you come here every day? And it's sort of extraordinary for family members to say that to me, because they're having so much pain and they're worried about staff members feeling that pain. But what I do is I reassure them that our work is our gift to them. And I think for staff members, we feel so fulfilled when we can make this very, very difficult time a little bit easier. And I think that's what it's all about. Feeling positive about the small differences that you're able to make in a person's life or in a family's life that makes a dying experience a little bit easier.